A breast cancer diagnosis is hard news at any age. But what happens if you're diagnosed in your 20s? Challenging, right? Very challenging. You're in this no woman's land where you're too old to be a kid, but at the same time, you're still figuring it out. Adult, whether start your career, whether you want to get married, whatever. In today's episode, we are going to talk to three young girls who were diagnosed in their 20s. Thank you, young girls, for taking our time for this conversation. We are so grateful to you. Now, I would like that each of you introduce yourself, please.
So my name is Ananya Pendekanti. Received treatment since then. So I underwent chemotherapy, surgery, radiation, physiotherapy, and I'm happy to say that I'm now in remission. We can move on to the
Sushmita.
next.
Okay, hi everyone. My name is Sushmitaa Kumari. I am a cabin crew with Vistara. Actually, yes, so I'm a cabin crew, and I was 26 when I got diagnosed, but actually it was not very clear by the time whether it is cancer or not. So it kind of led to a delay for a time being, but still, with God's grace, I think within a span of time, I completed my chemo, then my surgery, and then radiation, and I'm currently on hormone therapy since then.
Hello everyone, my name is Poorva and I'm a chartered accountant by profession. At the age of 25, when I was having a daughter of 8 months old, so during feeding I came to know that there is some lump. So I got the cancer very young at 25, and then followed by the treatment, chemo, surgery, then radiations, then hormonal therapy. So still I'm on the medications and it's going on.
Okay, girls, let me ask you one question. When all three of you were diagnosed in different time zones, were you easily able to find out more people whom you could connect to? Was it easy to identify other patients in a similar age group? Poorva.
In my case, yes, because when I met my doctor, he introduced me to another young girl who was just 22 years old and she was not married. So somewhere that point connected to me. Okay, so like if I'm having someone to look for, so कुछ नए अगर पेशेंट्स वापस आएंगे तो उनके लिए मैं खड़ी रहूंगी कहीं ना कहीं, ऐसे तभी आया था तो था. बट जैसे पूछा कि सब जगह पे ये नहीं है, दिस इज नॉट अ सिनेरियो ऑल ओवर, बिकॉज मोर डजंट वांट टू कम इन फ्रंट एंड उनको बोलना नहीं रहता या फिर उनको बताना नहीं रहता कि हमको इतने यंग एज में कैंसर हुआ है. तो इट्स लाइक कि हर एक सिचुएशन डिफरेंट है हर एक सिटी में. सो पूना में तो मुझे मिला था.
Sushmita.
For me, no, because first of all, I was not able to accept it myself that I have got a disease like this. And then, of course, the knowledge that we have about this disease is very, very minute. Unless you have it, you don't know anything about it. So when it happened, and in the process when I was getting ready, that I have to accept the fact that now on things will change and everything. So the first thing I wanted to I was looking comfort in was to find a lot of people, and especially my age or something of my kind. But I couldn't. So after a point of time when the doctor realized that she's really paranoid, so she gave me a number of one patient who was diagnosed before me, and she completed her treatment. So she was even younger than me. So she was the only person I had to, even more than doctors, I used to go and call her that, I'm facing something like this. Is it happening the same way with you? Like, did it happen? So she was like, yes, yes, it's normal. And that was something that used to, give me some relief that, okay, I am not the only one. But then on the other hand, I tried to search a lot of people, like when we look for testimonies and all, and it is very rare. I mean, people do not want to come up and talk about it. They do not want to reveal their identity. And if at all somebody is doing, then they would not exactly tell you what all has happened, how it has happened, and how will it treat you like that. So it was very, very difficult for me.
What about you, Ananya?
I got diagnosed actually during the peak of COVID in India. So that was the Delta wave. So that also, I think, played a role in, not being able to find anyone. I asked my oncologist and I said, can you let me know if there's anyone, in and around my age group who I could speak with and talk to. But I didn't find anyone. And I looked online actually, and I was actually shocked to find the lack of support groups, the lack of people speaking up about it online as well. So, whenever I went in for screening or for tests or for chemo, I just saw people much older than me and uh, very quickly realized that, as we have the cancer in common, but everything else is very different when you're young. You need someone who will understand what you're facing. It could be that you're studying, it could be that you're working, and it's very difficult for someone in their 60s or 70s to relate to what's happening to you as a 20 or a 30-year-old. So I actually had no one during my journey, and so I was very keen that I should help when someone else is going through it. So yes, in my case, absolutely no one.
So one common thread we find on all these three young girls is that lack of support or very, very minimal support. So with their permission, if they agree, then in the description box, we will add the email address of these young girls. In case anybody would like to reach out to them, you can do that by sending them an email. All right. Okay. Next question that comes to our mind is, Poorva, yeah, all three of you I'll address. Whosoever would like to speak first. What was that one thing besides the fear that was bothering you or that troubled you? जब पता चला कि मुझे कैंसर है या मुझे ब्रेस्ट कैंसर है. There were so many
I'll
problems,
go
I'm sure,
first.
but we'll start the first problem. What was it?
Okay. In my case, it was just like I was feeding my baby. So she was just 8 months old. And कैंसर का फियर नहीं था क्योंकि जैसे बताया गया था कि मेरे आंट्स को भी था कैंसर. सो आई हैव सीन देयर जर्नी. बट द थिंग वाज कि वो इतनी मेरी बेटी इतनी छोटी थी. सो आई वाज नॉट गेटिंग कि मतलब अभी उसका ध्यान कैसे रखूं या फिर लाइक फीडिंग चल रहा है तो उसका थोड़ा फूड बाहर का एंड जो भी है फीडिंग का वो चल रहा है तो ब्रेस्ट कैंसर का पूरा ट्रीटमेंट स्टार्ट करेंगे तो वो स्टॉप करना पड़ेगा एंड वो हुआ ही मतलब लैक्टेशन आई हैड टू स्टॉप एंड उसको फिर कैसे संभालो. सो दैट वाज अ थिंग. बट माय इन लॉज एंड माय मदर मतलब सबने उसका ख्याल रखा. सो आई कुड बाउंस बैक एंड आई कुड फाइट विद इट. बट वो फर्स्ट था कि मे बी शायद बच्ची नहीं रहती तो कुछ अलग था. बट जस्ट लाइक इट्स अनदर रिस्पॉन्सिबिलिटी. वो पूर्वा साइड में होके मेरी माँ बहुत जग गई थी तब. बट शी ओनली गिव मी लॉट ऑफ स्ट्रेंथ कि हाँ मुझे फाइट बैक करना है, मुझे मेरी लड़की के लिए खड़ा रहना है बिकॉज आई वांट टू बी देयर विथ हर. लाइक एक माँ का जो भी करना है वो मुझे सब कुछ करना था. सो
Okay. अब पूर्वा की बात सुन के मुझे एक thought आई. She was married. She had little daughter. Sushmitaa and Ananya, both of you are unmarried. Do you think you faced or you heard things which regarding marriage and breast cancer? Anything on it?
Absolutely. I think cancer itself एक ऐसा नाम है, एक तो awareness बहुत कम है, and secondly it is such a fatal disease because previously very rare people used to get it, and by the time they get diagnosed वो late हो जाता था. So I've seen my grandmother, मेरी नानी को था, but she had lung cancer. So I have seen her struggling, but also till then I was not very curious to know कि कैंसर होता क्या है, क्योंकि हमें यही पता होता है कैंसर एक ऐसी बीमारी है जिसमें लोग मर जाते हैं. That's it. Oh my God, उसको कैंसर हो गया. And one very weird thing which is associated with cancer is earlier, I don't know if people are still doing that, but when they talk about cancer or when they take the name cancer, their volume goes down. I don't know why, as if it's a myth. Why? Like, oh, the entire statement will be nice, but oh, she has cancer. So why does that go down? I mean, it's not my fault. I'm not the thief or anything like that. So the first time, and I totally agree with Poorva, because आपकी लाइफ में एक कुछ ना कुछ ऐसा चल रहा होता है जब आपको लगता है यार काश अभी ये नहीं होता, अगर ये नहीं होता तो ऐसा होता. तो maybe I would have. But actually अगर पूछेंगे तो हम कभी भी ready नहीं. We would, if given a choice, we would never accept it, right? But मेरे साथ जब हुआ तो मैं एक तो अपने करियर के पीक पे थी उस टाइम पे. I was actually waiting. I was about to get something that I waited for 5 years of my career and all of that. And secondly, breast cancer being such a sensitive part of your feminine side, कि आपको ऐसा लगता है कि यार इसके बिना क्या. एंड देन जब मैं कीमो के लिए जाती थी तो वहां पे मोस्टली एल्डर पीपल वर देयर एंड ऑल ऑफ दैट. तो सब मेरी मॉम को एड्रेस करते थे ये सोच के कि शी वुड बी पेशेंट. लाइक वो ऐसे प्री कंसीव नोशन है कि यही होंगी पेशेंट, ये तो हो नहीं सकती. And when they used to know about me, they were like, oh, acha. So a lot of people used to sit with my mother and tell, लड़की की तो जिंदगी खराब हो गई ना. अगर शादी हो गई होती और बच्चा हो गया होता तो अलग बात है. अब शादी कौन करेगा, अब तो क्या होगा. लोग तो आजकल शादी के बाद भी छोड़ देते हैं. So it does not, I mean, of course it does leave something on your head, but as where my mother was looking from, it was very disheartening for her to know कि मेरी डॉटर में कोई कमी है, अब तो लड़की के साथ ऐसा कैसे होगा. तो ये बहुत ही ज्यादा एसोसिएटेड है विद women being into this thing. So I got that a lot, and very weird questions people have, or very weird way of supporting they have. I mean, they would never come and tell you ki, you know what, I know somebody who has survived, but rather they'll come and tell you, oh, I know, my grandmother passed away with cancer. Okay, sorry, but I don't want to hear this at this point of time. Or I want to hear that it's okay and you will make it through, not sympathy. And with this, I think I will also like to address that a lot of people think this as a sympathy वाला चीज कि जब मैं बात कर रही हूँ तो मुझे sympathy चाहिए. But मुझे ऐसा लगता है कि मुझे किसी की भी sympathy काम नहीं आएगी. Like nothing will help. Nobody will be able to help unless I am doing it myself. तो and plus I was at such a young age कि मैं पहले तो खुद ही नहीं accept करने के लिए ready थी कि I will lose a very important part of my feminine body and all of that. But then yes, here I am, and I think I don't regret any of the decisions that were taken during that time.
Ananya.
I'll agree with what Sushmitaa said. It didn't happen to me personally, but once I started talking to other girls and women, the whole she's not eligible for marriage. There's something wrong with her. She's had cancer. She could pass it on to her kids. I don't know what all goes on in people's minds, but somehow, yes, definitely, what I've heard from other patients is they're no longer considered suitable, for marriage. And it's heartbreaking because what they're going through is already so difficult. It is so traumatic. This is not something that should be playing on their minds or even be a consideration. But unfortunately that is the case. And I'm not just saying it is in like rural communities. I'm saying it's I've seen it even in like affluent families and in like modern society. So that is one. The second, I think, would be the reaction of people where how come you got it when you're so young and you're so fit and you're a sports person. And I'd like to just tell them that cancer doesn't discriminate. It doesn't matter if you're young or you're old or you're fit or you're not. In fact, most people don't even know that men can also get breast cancer. I think it's a complete lack of awareness on the subject because it's not, again, spoken about, which is what we're trying to change. So, and I also think what happens is, October being the breast cancer awareness month, right? It's called pink washing. I think you've heard of the term. And what you see is the usual pink ribbon, and people will be running marathons and, they'll wear the ribbon. And if you actually ask any of them what breast cancer is, other than people who've had personal experience or they've seen someone they love go through it, nobody really knows anything about cancer, which is why, again, like both of them shared that fear around cancer, telling us that someone passed away from it. That's all you hear, right? Cancer is, oh no, that man had it and he died. Oh, this lady got it and she died. That's all they know. They don't know that now, early detection is key. They don't know that despite, okay, whenever you get detected, also there are many options available to you. There has been a lot of advancement in, in the field of medicine, but still we carry that taboo and stigma and that fear, around cancer, which we have to slowly start through these efforts, changing, so that people realize that it's not how it was before and how it was looked at before. And more young people are getting diagnosed with cancer. I mean, I just keep getting recommendations and referrals from my oncologist, and every time I get it, the patient just seems to be getting younger, 22, 21, 18. So
One question.
yes.
Okay. Another question. All three of you girls are strong, with good willpower, strong willpower, etc., etc. One question. Working professionals, good qualified, whatever. फिर भी ऐसा फेज आता है जब आप लो थे कि आप थ्रू आउट वेरी बोल्ड, बहुत स्ट्रांग थे, नो ब्लू पीरियड, नो लो फेज, और अगर आया था कि नहीं आया था? बिकॉज ये बहुत इंपॉर्टेंट है. होता क्या है, ऑन सोशल मीडिया एवरीबडी इज टॉकिंग अबाउट दिस हैपेंड. विद ड्यू रिस्पेक्ट टू यू गर्ल्स, यंगर जनरेशन इज वेरी बोल्ड, बट वी नीड टू ऑल्सो से क्या तुम तीनों कभी कभी डाउन होते थे, अपसेट होते थे, रोते थे, और तो क्या करते थे व्हेन यू वर डाउन एंड आउट? सुष्मिता.
Okay, so one thing I would like to address is social media platform. वैसे तो people are using it for various means, but I think people are very fooled by that, because everything is so, whatever is put out there is so unreal than actually what you go through. With myself also, I have shared a lot of videos in, and I've tried to incorporate everything that I am actually going through and the breakdown and everything. But I was always, given a pat for sharing that thing, but nobody actually understood the pain behind that. That, it's not that I'm sharing, so I'm so brave and all, and I don't cry. So, of course, I do. And today, when we're able to sit here and talk, I think it is just because we've crossed that thing. It does not mean that we did not have our backlashes or we did not have our, down time. Because I think every moment when, especially chemo phase, I think it is the most dangerous thing of all. So every day there, for with me especially, there used to be one moment when I used to feel like, that's it, I can't, I'm giving up, I won't be able to do it. And when people are even motivating you and all, when even when somebody says no ki koi baat nahi, theek ho jayega, you don't know that कि होगा या नहीं होगा. And it's very easy to say, because what else will you say? The biggest problem is people do not know how to address somebody who's actually suffering from cancer. आपको बात क्या करनी है? The maximum number of messages and all when I got from people who reached out to me, those, and also the people who did not reach out to me, उनका बहुत बेसिक से एक जवाब रहता है, यार हमें समझ ही नहीं आया हम क्या बात करें, हमारी हिम्मत ही नहीं हुई, आपकी बात करने की हिम्मत नहीं हो रही है, we are to dealing with that. And then also there are so many this thing, but every day I used to feel एक बार तो कि बस हो गया, अभी नहीं. But as we say ना कि ये जो एक कॉज आ जाता है ना बीच में कि यार अभी ना हुआ होता, अभी मेरा ये इंपॉर्टेंट चल रहा है, आई थिंक दैट इज समथिंग दैट प्लेड एज अ रोल फॉर मी टू किक इट बैक, कि ये मेरा यहाँ छूटा है तो मुझे वापस लेना है, आई वांट टू अचीव दैट बैक अगेन. आई कांट बी, आई न्यू आई विल बी स्टार्टिंग फ्रॉम स्क्रैच, बट इट्स ओके, आई विल डू इट अगेन. एंड every time the moment it used to cross my mind कि okay let's give up, तो मैं उसके बाद का सोचती थी what after that. सब if you go and do something stupid, फिर तो स्टोरी खत्म हो जाती है, फिर तो ये पूरा किस्सा ही खत्म, टॉपिक ही खत्म, फिर तो स्ट्रगल ही किसी चीज का नहीं है. तो there are just two options, you have to fight back or you give it. When you give up, तो फिर तो everything is over ना, then तो there is nothing to even talk about it. So give up तो मतलब मुझे ऐसा लगता है once it is there and you have, and it is not just कि आज मैंने डिसाइड कर लिया मैं लड़के रहूंगी, वो मुझे 2 घंटे बाद फिर I will break down, वो कल फिर होगा. And it was a constant effort of falling down and getting up, falling down and getting up. And especially we are living in a area जहाँ पे आप ऐसे कम्युनिटी में कि आपको ऐसे अलाइक पीपल बहुत कम मिलते हैं. लाइक मुझे लग रहा है कि मैं आज बैठ के इनसे बात कर पा रही हूँ, बट इट वुड हैव बीन सो नाइस ना अगर मेरे को 2 साल पहले मिल गए होते, तो मेरे लिए और कितना अच्छा हो सकता था. बट ये नहीं हुआ, एंड दैट इज आई थिंक दैट इज ऑल्सो वन रीजन व्हेन I'm a very private person. I would not like to put anything on social media, but I've literally jotted down my entire cancer journey on social media, that even if one person gets the motivation. And I've got such messages also from people who are very basic, suffering from thyroid, PCOD. And they were like, we were paranoid taking an injection also for thyroid. I never used to go for my thyroid test क्योंकि मुझे पता होता था मुझे इंजेक्शन लगेगा. बट आफ्टर लुकिंग एट यू मुझे लग रहा है यार व्हाट इज दिस, हम इतना तो कर ही सकते हैं. तो with us, so when we used to go and step up on that bed knowing that you'll be given something in your body which is going to you know wreck your days, day and night, another week, so that takes a lot of willpower. But again, there is always a light to the end of the tunnel. So I think it follows the good and bad times. It does follow. If we ask this question of why me, there is no answer, because I think why not? Who else will take it? Nobody will be willing to take this personally. If we tell somebody कि हम एक सुई चुबो देंगे सब भाग जाएंगे, तो cancer तो is a very big thing. लेकिन yeah, so I think when you're chosen ones, just fight back. And yeah, this emotional, this thing will come a lot. I mean, I तो used to have so many thoughts in my head ना, कि मुझे कभी कभी लगता था अगर मैं किसी से शेयर करूंगी ना तो वो बोलेगा यार ये पागल है क्या, क्या क्या सोचती है. और एक तो लोगों के लिए बड़ा इजी हो जाता है पागल बोल देना, एंड देन यू स्टार्ट डाउटिंग योरसेल्फ कि मैं सच में पागल हो गई हूँ क्या, बिकॉज आई एम रिएक्टिंग टू एवरीथिंग. But there are so many things, there are so many reactions that are drug driven, that you don't even know is happening to your body. You yourself are so confused. तो उस टाइम पे फाइट बैक करना ही एक ऑप्शन रहता है, जो सबसे अच्छा ऑप्शन है, क्योंकि अगर आपने गिव अप कर दिया फिर तो आई थिंक देयर इज नथिंग टू टॉक अबाउट इट ओनली. तो ये this has to be a constant effort.
Okay, Ananya, you?
Continuing from before, I think what happens with a cancer journey is, as much as it is physical, I think a large part of it is mental, right? Physically, we're taking a battering every day, but how do you show up the next day? Whether it's chemo week after week or radiation, which we have to go for every day without a break. It's finally what's happening in here. So I think it's very important, to have support. Okay, a lot of us didn't. I mean, in my case, yeah, not from an external source, but I had a very supportive family. I had very supportive friends, and that was great. So I think that plays a huge role also in helping you show up and continue, because cancer treatments are not short. They last months, and then you're on medication for years after that. It's not easy at all. And I think what also happens is, right, from what Sushmitaa was saying, people talking about things. I think happy, positive conversations are easy to have. It is often the difficult conversations that people struggle with. And so that is why people don't know how to reach out to you. They don't know how to address it. They don't know what to say to comfort you. And then they end up messing up. It's not their intention, but it's very difficult to have conversations around cancer. And we have to normalize it a bit so that it gets easier to speak about it, so that people get help, especially those who don't have resources. And when it comes to emotions, yes, I had a whole slew of them, ups and downs. And like she said, a lot of it is medically induced. You are going through so many things. I was getting Zolodex injections on one side, so you have medically induced menopause, and then you have chemo, and then you have your booster doses for your WBCs. There's so much going on in your system. There's so much nausea. You can't eat what you want. You're constipated, or you have diarrhea. You can't sleep. Can you imagine what your body is going through on any given day? It's a lot. And so to have all your emotions in check and just go through it peacefully is impossible. I mean, if someone is going through that, if they're really able to, great. But I think you should allow yourself to feel whatever it is, whether it's anger, whether it's, you're frustrated or you're upset. It's okay. Let it come out. I think it's better out than festering inside. And you should have a safe space around you where you feel comfortable enough to express whatever it is that you're feeling. Some people write, some people paint, some people scream. I mean, whatever your outlet is, it could be a swim, it could be a walk. I think it's important to normalize, feeling all over the place during treatment. It's common, and I think both of them would agree as well that you are not going to have all good days. There are some good days, And good, take them, store them, keep them with you, because they help you get through the bad days. And yes, like she said, there is light at the end of the tunnel. You have to believe in it to go forward, because you don't really have a choice. You can't just decide to stop treatment midway. There are those who do, and I respect them for it, but there are some of us who can't. And the only way forward is to just taking it, I think, one day at a time really helps. As cliched as it is, when you start thinking long term, it's very overwhelming, because you have months and months ahead with no clarity, with no idea what your scan results or test results are going to be. So I think for me, what really helped personally was, okay, today I'm going to finish today successfully and then move on to the next day. So yeah.
What about you, Poorva? You had a little baby girl, so it was a different game for you, right? Altogether.
Yeah. In my case it was like जैसे बोला पहले lactation stop करने के लिए लगा, उसके बिना में बायोप्सी के लिए जा नहीं पा रहे थे. So it was like first I was supposed to stop the lactation, and in that जो lump left breast में था वो आगे मूव होके nodes तक चला गया. So the stage of cancer was also changed. और मुझे पता है कि मुझे जस्ट याद आया अभी सब आप दोनों की बातें सुन के कि जब ये फर्स्ट टाइम रिपोर्ट आया हाथ में, उस टाइम से पेट स्कैन तक माय हस्बैंड वाज वर्क नॉट विथ मी, वो भी सीए है, तो वो चंडीगढ़ उनके ऑडिट के लिए गए थे. सो मुझे जब मेरे मौसा जी ने बताया, ही इज डॉक्टर, कि ऐसे ऐसे है, आपका रिपोर्ट आया है, सो ही वाज थिंकिंग कि शायद मैं पैनिक हो जाऊंगी या फिर कुछ डर जाऊंगी. तो मुझे मेरे लिए कुछ नहीं था, आई वाज जस्ट कि हाउ माय हस्बैंड इज गोइंग टू रिएक्ट, लाइक कि वी आर हैविंग, मतलब बहुत अच्छे से सब चल रहा था. सो मुझे तो वैसे था कि उनको कुछ ना लगे, लाइक मतलब हाउ ही विल रिएक्ट. ऑफ कोर्स ही इज ऑलवेज सपोर्टिव, हमेशा करता है, बट वो एक कंसर्न था कि अरे पुणे में अभी वो नहीं है जब मेरा ये भी रिपोर्ट आया है, इवन फॉर द पेट स्कैन ही इज नॉट देयर. तो वो हो गया एक सीन. बट आने के बाद फिर उनको समझाया, तो आई थॉट कि मैं तो स्ट्रांग हूँ, बट शायद वो नहीं है इतने, शायद वो ज्यादा लाइक रोएंगे या कुछ होगा ऐसे. बट उन्होंने भी अच्छे से हैंडल किया. आफ्टर दैट था कि कीमो जब स्टार्ट हुआ तो जैसे आपने पूछा निधि मैम की कभी रोना आया या क्या आया, तो क्योंकि जैसे मैंने बोला कि जर्नी मासियों की देखी थी, तो आई नो कि मतलब एक मेंटली बोलते ना, हाँ ठीक है ये ऐसा है, हमें स्ट्रांग रहना है या फिर करना है. सिर्फ जब डॉक्टर ने भी जो साइड इफेक्ट्स बोले थे कीमो के कि व्हाट्स गोइंग टू हैपन, लाइक कीमो देने के बाद द नेक्स्ट 5 days यू आर गोइंग टू फेस द ऑल अप्स एंड डाउन्स, हम आपको सारे एंटीबायोटिक्स देने वाले हैं, एंड दिस इज गोइंग टू हैपन, लाइक यू मे बी कॉन्स्टिपेटेड, यू मे बी यू विल हैव अ डायरिया और एनीथिंग, लाइक सब कुछ हो सकता है, यू मे गेट एन इन्फेक्शन. तो वो वाला 5 days का आफ्टर एवरी कीमो, वो 5 days वाज वेरी क्रूशियल. तब ऐसे था कि शायद मेरे बदन में कुछ जान ही नहीं है. माय मम्मा यूज्ड टू पुश मी, कम ऑन यू हैव टू वेक अप, वी हैव टू गो फॉर अ वॉक एंड लाइक दैट. पर ऐसे लगता था कि शायद वो 5 days हैज टू बी डिफिकल्ट एवरी टाइम. बट मुझे जब तक याद आ रहा है, मैं सिर्फ 2 टाइम मेरे पूरे जर्नी में ऑलमोस्ट 1.5 years का पूरा मेरा कीमो का ट्रीटमेंट, सॉरी कैंसर का ट्रीटमेंट था, उसमें डाउन हो गई. एक तो था जब सर्जरी होके आ गई, बायलैटरल मैस्टेक्टोमी, और सर ने हाथ में थमा दिया कि व्हाट आर यू सपोज टू डू, लाइक पोस्ट सर्जरी आपको क्या करना है, डूज एंड डोंट्स. And the first thing was written over there that you are not supposed to lift anything more than 2 kgs. And I cried that day on the bed. तब तक मैं कुछ नहीं करी. तो डॉक्टर बोले क्या हो गया? I said my baby is of course more than 2 kgs and you are asking me that not to lift. तो वो बोले नहीं, मतलब baby is allowed, I'm not talking about the weight. तो ये एक था. एंड जैसे अनन्या बोली, इवन आई वाज आल्सो ऑन Zoladex. तो Zoladex होने के बाद भी सर बोले थे डॉक्टर कि यू विल फेस अ मेनोपॉज एंड वो पूरे मूड स्विंग्स हो जाएंगे, यू मे फील अ डिप्रेशन काइंड ऑफ थिंग. और वो बहुत अजीब था, लाइक कि कुछ भी थॉट्स आ रहे थे पूरे मेरे, कीमो रेडिएशन सर्जरी तक कुछ नहीं, बट वो जैसे इंजेक्शंस की वजह से समझ में नहीं रहता कि हार्मोन्स वेर नॉट इन माय कंट्रोल, एंड आई वाज थिंकिंग एनीथिंग. मतलब एक पॉइंट पे से भी लगा था कि शायद मैं मतलब मैं मेरे बच्चे के लिए खड़ी हूँ, बट आई एम आई डूइंग जस्टिस टू माय हस्बैंड, लाइक कि हम दोनों ने साथ में पढ़े हैं, हम दोनों ने साथ में मिलके, वी आर फ्रॉम द सेम कास्ट, एंड हमने सब साथ में करके मतलब घर वालों के हिस्से शादी की सबकी. तो हम सब दोनों ने साथ पहले से साथ में सपने देखे. सो फॉर दैट मोमेंट आई वाज अगेन थिंकिंग कि क्या मैं ये कर रही हूँ. बट फिर समझ में आ गया ये दिस इज जस्ट बिकॉज ऑफ द मेडिसिन. एंड जब जैसे वो 1 मंथ का वो डिप्रेशन पीरियड खत्म हो गया, जैसे उन्होंने बोला कि होगा, तो आई वॉज वेरी नॉर्मल. बट आज जब याद करती हूँ वो तो बहुत हंसी आती है. व्हेन माय हस्बैंड यूज्ड टू टीज मी, नाउ देख तू उस टाइम क्या बोल रही थी, ऐसे करना चाहिए था क्या मैंने, वगैरह ऐसे करके मुझे चिढ़ाते हैं. बट ऐसे होता है, अप्स एंड डाउन्स आते हैं. सो अभी भी जितने भी पेशेंट्स कनेक्ट होते हैं वो ही पूछते हैं कि हमें आज ऐसे हो रहा है, हम लो फील कर रहे हैं, आज हम कुछ नई समस्या लेके आ रहे हैं. तो आई यूज टू से कि हाँ ये मैंने भी फेस किया है, ये ऐसे ही होता है. एंड आप सिर्फ हिम्मत रखो, आपकी विल पावर स्ट्रांग रखो. अगर विल पावर स्ट्रांग रखोगे तो द मेडिसिन विल गोइंग टू वर्क ऑन यू. If you lose your willpower, then those medicines are not going to give any result out of it. So इतना ही है कि रोके तो आप अपनी ही निगेटिविटी बढ़ाते हो, आपकी ही तबीयत और ज्यादा खराब करते हो. सो इट्स वेरी इंपॉर्टेंट कि इमोशंस है, ठीक है, एक बार आपको दुखी हो जाओगे, यू जस्ट टेक दोज इमोशंस आउट. बट यू कैन नॉट बी सैड और यू कैन नॉट बी थ्रू आउट द ट्रीटमेंट, बिकॉज इट्स नॉट गोइंग टू हेल्प यू, इट्स गोइंग टू टेक backward only.
Mhm. While she's talking about baby and things, Ananya, if I remember correctly, you had something to share, right? And you said you would like to say.
Yes. So again, in my case, my oncologist, my medical oncologist, had a word with me and said, "Okay, since you're diagnosed with triple negative and it's very chemo intensive, do you want to consider undergoing fertility preservation before your treatment?" Now, I think this is a very important conversation to have with your oncologist. Not many girls are aware that it's an option for them. Now, it's not applicable in every case, but I think it's important to know in case it is applicable to you. And in my case, it was, though I had actually conflicting advice from my surgeon and my oncologist. So my surgeons in Hyderabad said that I don't have to go through it, that I'll be fine. But my oncologist said that, I've had girls come back to me in tears and regretting, the fact that they didn't consider it. And now they're unable to conceive. And so she said, if it's something you want, you want to have kids in future, then you should consider it. So I took that decision of delaying my treatment by almost more than 3 weeks, actually, a month. And I underwent one cycle of fertility preservation and then began my chemo. I do not regret that decision. I think we took it, there was a lot of pressure, there was a lot of fear because you don't know what can happen in 1 month with cancer. But I think we considered all the facts. It's nice to have a doctor who you can speak to and have like a healthy, kind of a discussion with, which I was lucky enough to have. And so that's why when I speak to girls now or any kind of advocacy, thing that I do, I always make sure to include this as a point because I've come to realize that most women don't even know that it's an option.
Yeah.
So it's a very important point.
The important point from takeaway from Ananya is that please, she has just stated her part of the story, what was applicable in her case. She is not saying please ये कराओ या ना करो. All she is saying is कि प्लीज ये ऑप्शन अवेलेबल होती है तो इसको बारे में हमें पता होना चाहिए और अपने ऑन्कोलॉजिस्ट से बात करिए कि ये प्रिजर्वेशन हो सकता है. ठीक है. Now, Sushmita, another thing. Now, this I'm asking you, beta, that the cost of the cancer treatment, हमें सबको पता है महंगा होता है. What did you face?
Okay, so with me it was a very strange thing, but I think I had to sit here today and share it. So I think that's why all this happened. So one thing is we take few things for granted. जैसे कि young people getting cancer, ये we are not something that we are expecting every day. क्योंकि एक age में होता है and all of that. So I'll go back a little bit in history. So before this, I was into sports and I have represented India in another country in handball. I've played boxing. I have been, a sports person my entire life till the time I was in college and till the time I pursued this job. And also, my father was in army. So there was this rule in army that till the time your daughter is unmarried, so everything is going to be sponsored. Any medical expenses is going to be sponsored by the army. So when one thing what took me by which I was taken aback was one, because I was in sports and I was so fit all my life that I couldn't digest the fact that I had cancer really. Like I have been, so much into fitness, gymming, and all of that. And when we figured all this out and we sat with the doctor, so the initial, uh, the rough estimate that he gave me was of somewhere around 12 lakh rupees. Rough. And I'll tell you, whatever he says, you could be lucky that you probably finish it in half of it, or you might have to pay twice as the amount because things can go that wrong during the this thing. So when I was giving this thing, uh, there were things that went wrong so many times that I've got some infection, and now there are additional injections going on, which was not even there, neither in mind nor in budget and all of that. So, so when we figured it out, we went to army first, of course. So I got to know that particular year, the rule got amended, and it changed to the fact that if she's 25 above and she's earning, so we are not going to sponsor anything. So that left me with no option, because just recently, I used to have, because there was COVID, of course, it took a toll on your salary and everything and income. And what we're doing is, my brother got married and all of that. So we did not really have that much of amount. And I think anybody who's from a middle class family, or normally, I think we do not keep that much of money with us any given day. And because I was so confident of the fact that I will never have such kind of disease, which I did not even know. Like the first time somebody told me you had cancer, I had to go and Google it to find out what cancer it is, and then I got to know there are so many types of cancer. People generalize it in a way, so I also did not know. And so that time, that thought, because that breaks you right there. Should I even start? Because the amount that he's told me, I don't have it. I don't think I'll be able to, make it through. So that breaks you over there. But trust me, I think everything works out in a way you won't know. I mean, you just have to go. So that time when I was told, and we went to doctor, we went to army and all of that, and we were left with nothing. And I was really in a situation where I thought, ki, I don't have time that I should go and start in a government hospital. I don't know where this amount will come, and this is just an estimate. I need to have something as a backup as well. I don't know if I start, I will be able to make it through the treatment and all. So I think a piece of advice to everybody that, put your health first everywhere. Not like me. Like I still accept the fact that I think it was my fault that I was too overconfident with the fact that I cannot fall sick, because I never had fever. I never thought I will ever have it. But something that I got was, the father of all. So just put yourself in the priority. Have some or the other backup option. I think things will work out in a way, but at least you will have something to begin with. And once you begin the journey, you will be able to, I mean, you won't stop, then you will go and doors will unlock. But that point, to understand that where to start from, and how will I do it, that is
Very
very
important.
important.
Yeah. Sorry, Sushma, I'm cutting across again. हम वो पॉइंट बार बार कहना चाहेंगे कि अक्सर अक्सर ज्यादातर यंग इंडिया में अभी भी कॉन्सेप्ट ऑफ गेटिंग आवरसेल्फ हेल्थ इंश्योरेंस, आई एम अफ्रेड हम स्टिल वी आर इन अवर फ्लेजलिंग स्टेज, हमें नहीं समझ में आता. ये 3 यंग बच्चे बैठे हुए हमारे सामने और वो बार बार कह रहे हैं वी वर डायग्नोज्ड एट अ वेरी यंग एज. तो कभी भी हो सकता है. तो टेक अ होम पॉइंट फ्रॉम सुष्मिता इज, प्लीज हम अपने बच्चों की, अगर पेरेंट्स देखते हैं और अगर यंग बच्चे खुद देखते हैं ये कॉन्वर्सेशन विद दीज 3 यंग ब्रेव गर्ल्स, प्लीज मेक श्योर आपका हेल्थ इंश्योरेंस इज इन प्लेस. थोड़ा ज्यादा जितना भी, प्लीज स्टार्ट गेट गोइंग. पूर्वा, अभी आपने अपने लास्ट बात में कहा कि बायलैटरल हुआ. बायलैटरल at the age of 25 is not easy to deal. बहुत ब्रेव हो तुम,
That's
सब
true.
कुछ, बट फिर भी कैसे किया उसको डील? What tips would you like
Okay.
to, what anything that you like to say to anybody who's listening you here?
Yes, cancer कि जब ट्रीटमेंट रहती है तो दैट इज अ मेन थिंग कि सर्जरी जब आती है तो इट्स अ क्वेश्चन कि आपकी कैसी सर्जरी होगी, यूनिलैटरल, बायलैटरल, जस्ट स्कूपिंग और जस्ट रिमूविंग दैट पर्टिकुलर रीजन, और फिर बहुत डीप में जाएंगे या नहीं जाएंगे। तो दिस ऑल थिंग्स डिपेंड्स अपॉन आपका कैंसर कितना फैला हुआ है या फिर उसकी जैसे बोलते स्टेज क्या है। तो जैसे मैंने पहले बोला कि मेरा जस्ट बिकॉज ऑफ लैक्टेशन जब वो चेंज हो गया तो स्टेज 3 का स्टेज 4 हो गया। जस्ट इट बाकी के ऑर्गन्स को नहीं लगा था बट वो नोट्स तक पहुंच गया था, एंड दैट्स व्हाई डॉक्टर सेड कि 25 की उम्र है एंड वी डोंट वांट टू, एंड यू आर हैविंग ऑलरेडी जेनेटिक है आपके घर में, आपको पता है। सो हम फोर्थ स्टेज कैंसर के तरह ही आपको ट्रीटमेंट करेंगे। एंड मीनवाइल आई डिड अ ब्रैका टेस्ट, जेनेटिक टेस्टिंग, एंड उसमें आया ही कि इट वाज प्योरली जेनेटिक कैंसर। सो फिर वो जो रिपोर्ट था उससे हमें मतलब दैट वाज अ बेस फॉर मी टू डिसाइड कि शुड आई गो फॉर अ यूनिलैटरल मैस्टेक्टोमी और बायलैटरल मैस्टेक्टोमी। सो पूना के डॉक्टर्स जो थे, सर्जन जो जिनको मैं देख रही थी, तो ही वाज लाइक यू शुड गो फॉर अ यूनिलैटरल ओनली, आगे जाके देखेंगे हुआ राइट साइड में तो फिर कर लेंगे, अभी क्यों अब ये कर रहे हो। एंड बट माय ब्रदर इन लॉ एंड फादर इन लॉ बोथ आर द डॉक्टर्स, तो उनका ऐसे था कि नहीं, ही वाज माय ब्रदर इन लॉ वाज मोस्टली इंसिस्टिंग कि वी विल डू इन कोकिला बेन, मुंबई का जो है, तो वहां के डॉक्टर बोले कि नहीं, अगर ब्रैका आया है तो यू शुड गो फॉर अ बायलैटरल मैस्टेक्टोमी। सो वो थोड़ा डिसीजन में ये था कि शुड आई गो विद दिस एंड दैट, बट फाइनली विद डॉक्टर्स की सुनी, अपनी सुनी, हस्बैंड्स के साथ थोड़ी चर्चा की, और उसके बाद देन वी डिसाइडेड कि हाँ विल डू फॉर द बायलैटरल। तब ऐसे था कि ब्रैका के टेस्ट में ये भी आया था कि एज यू आर हैविंग मासियों को ओवेरियन कैंसर है, आपके इसमें भी 70 to 80% चांसेस आर देयर दैट कि आगे जाके आपको भी ओवेरियन कैंसर हो सकता है। सो द थिंग इज कि अभी आप 25 के हो, तो एट द एज ऑफ 35 वी विल डू फॉर द ओफ्रेक्टोमी आल्सो, मतलब आपके दोनों ओवरीज भी निकाल देंगे। अभी ही निकाल देते हैं, बट बोले कि 25 से बहुत एक कम एज है, सो वी वोंट गो फॉर द रिमूविंग एवरीथिंग। तो वो वाला एक अलग था कि हाँ चलो दिमाग में है, अभी भी मेरे दिमाग में है, ओके आई एम नॉट येट 35 बट डॉक्टर ने बोला है कि मुझे ये वाला करना है आगे जाके। सो जैसे आपने पूछा मैम कि दोनों ब्रेस्ट निकालना वाज नॉट अ मतलब इट्स अ रियली बोल्ड डिसीजन आई विल से, क्योंकि लोगों को बोलना नहीं रहता है, और फिर उनको वो बहुत दिक्कत आती है कि अरे फिर हम कैसे दिखेंगे। जैसे सुष्मिता और अनन्या ने बोला कि दैट इज वेरी लाइक हमारा बीइंग औरत या फिर फेमिनिज्म, वो इसके लिए हमारा एक मेन ऑर्गन और जस्ट टू हमें शो अप करने के लिए रहता है। सो वो बहुत दिक्कत वाला पार्ट था कि कैसे होगा, बट luckily with the support of my family, my doctors and everything, it went good, and I didn't go for any construction, मतलब reconstruction नहीं किया या फिर कोई implant surgery नहीं की। So it was purely just bilateral mastectomy, removing of the both the breast along with the nodes। और उसके बाद फिर था कि फिर बॉडी इमेज इशू ऐसे होते हैं लोगों को, जो फिर मैंने देखा कि जिनका एक ब्रेस्ट निकाला है या फिर जिनका थोड़ा स्कूपिंग करके सिर्फ जितना पार्ट निकाला है, उनमें फिर वो बहुत ऐसे होता था कि यार हम कैसे दिखेंगे या फिर के। और फिर जब वो मुझे सुनते थे, अच्छा आपको दोनों भी निकाल दिए, सो यू स्टिल नॉट हैविंग एनी प्रॉब्लम, लाइक हाउ कैन यू बी लाइक सो कॉन्फिडेंट एंड यू कैन टॉक। तो मुझे जैसे मैंने पहले भी बोला था, तो इट वाज जस्ट लाइक कि एक ऑर्गन है खराब हो गया है, आपको निकालना है, क्योंकि आपको आपकी पूरी बॉडी अच्छे से रखनी है। सो जैसे मैंने पहले भी बोला था कि खराब हुए मैंगोज है, मैंगो के पेटी में से निकालने हैं, क्योंकि बाकी के मैंगोज को बचाना है। सो इट वाज सो सिंपल लाइक दैट, एंड वो वैसे ही किया। और आई जस्ट वांट टू से कि आप जो भी सर्जरी कर रहे हो, यूनिलैटरल कर रहे हो, बायलैटरल कर रहे हो, और जो भी हो रहा है, डरिए मत। वो पार्ट जाने से या कुछ मतलब कम होने से आपकी लाइफ में से कुछ भी माइनस नहीं होने वाला है। इट्स जस्ट लाइक गोइंग टू सेव योर सेल्फ, एंड आपकी लाइफ उससे भी बहुत बढ़िया आगे जाके होने वाली है। सो यू कैन वेयर एनीथिंग वॉट एवर यू वॉन्ट, आपको कुछ भी इशू नहीं हो सकता है। सो यू जस्ट हैव टू बी कॉन्फिडेंट इन दैट। यस मैम।
वंडरफुल, वेरी नाइस। अभी इसने बायलैटरल का हमें बताया, उसने हमें फर्टिलिटी बताया। एक इश्यू आ जाता है बॉडी इमेज, बॉल्ड हो गए हम। वन लाइन में क्विकली गर्ल्स अपना अपना टेक बताओ, क्या मैसेज देना चाहोगे जो तुम्हें सुन रहा हो, जब बाल गए तो हम क्या करें, वो एक मेजर प्रॉब्लम। विल स्टार्ट विद अनन्या, वन लाइनर ईच गर्ल। हाउ टू डील
I
विद व्हेन माय हेयर गो अवे।
So I chose to be very proactive. I had long hair. I got it into a bob first. Then I think after my first chemo, I got into a boy cut. I enjoyed every stage. And then after my third, I lost all my hair and I got it, shaved. And I basically realized very early on that I'm not defined by my hair or my breasts. I think um, it's nice to know from other patients that, your hair grows back. And so I just had that hope, I think, and I enjoyed it. I enjoyed my phase. I went without a cap. Sometimes I would enjoy wearing a cap. Sometimes I would tie a scarf. I just enjoyed the process. And I think I had too many other worries. Chemo was very tough on me. So I think I never worried about my hair. It was all about just getting healthy and getting through each day. And my hair grew back and I'm happy. That's about it.
Sushmitaa.
I think I'll agree with Ananya. I would just say embrace it, because, of course, it is painful to see it going. The first time I had a bunch of hair in my head, and I was disheartened. But then I was like, I cannot see this every day. So I called in the barber and we trimmed it. That I cannot, you can't go through the same pain every day. If time stands stronger, you have to stand taller than that. So, and you knew, I mean, we were briefed about it. So how long more? I was waiting after my first chemo ki nahi hoga, but second chemo tak aisa ho gaya tha ki I went to comb and I had it in my hand. I sat and I cried, but then I was like, this is not the option, right? I have to. There are still 7 more chemos. So wo nikala, and then first it was trimmed and then there was short, but because it goes jad se, so ek point ke baad na, the small hair follicles also, they started pinching in the pillow. I was like, this is not working. So we got this guy, he got the ustra and we cleared it like proper. तो सर के तो ऑफ कोर्स हम निकाल सकते थे. बॉडी, आई थिंक देयर इज अ स्टेज व्हेन यू लूज योर eyelashes, you lose eyebrows and all. It does feel weird, but I knew that, this is me right now. You have to accept it like this, and the first step to acceptance is myself. So I never covered my head. A lot of people used to tell me कि सर ढक के चले जाओ, but क्यों, उससे क्या हो जाएगा? तो I never covered my head, hair, and anything. I went like that. And as painful as it is to see them go, it's equally a happy feeling when you see them coming back.
See, so
Like, if
important
given a
point,
choice, I
all
would
of
never
us
keep
here,
this
there's
short
3
hair,
girls here
but every
and
day I
one
just do this and I'm done.
middle-aged
She was
auntie
like,
here.
okay, I'll go and
Yeah.
look my old picture. I've grown, yeah, I've grown my hair and I look pretty, and then people, oh, your hair are coming back. So I think, yes, you feel bad at that moment, but it is required. It is the demand of the time and process. But when it comes back, it's very, very nice feeling. So that now I see, oh, I have to make my eyebrows. When you don't have it, you don't know what to enhance. But now when you have it, so then you get into that role. So it's a nice feeling when it comes back. And it's, I think, the demand of the time. So just go with the flow. I think embrace that thing. When I was bald, I used to say, I'll go and I'll do modeling, okay, the bald women and all of that. So I was happy with that also.
हम यहाँ पे 3 गर्ल्स की बातें सुन रहे हैं, बहुत ब्रेव बच्चों की. One thing that I would like to say is that this conversation can go on for hours, I think, without us stopping. We will have to make it short, I think. But एक बात हम कहना चाहेंगे, ये 3 छोटे बच्चे, young girls, have come out in the open to talk about their journey. Why? हमें वो स्टिग्मा तोड़ना है, हमें वो टैबू उसका हटाना है. हाय, ब्रेस्ट कैंसर हो गया. जैसे सुष्मिता ने बोला कि आवाज धीरी जो हो जाती है कैंसर की, आवाज धीरी नहीं करो. ये 3 बच्चे बाहर आके बोल रहे हैं और आवाज ऊंची करके, बुलंद करके, कि कैंसर इज क्योरेबल, इट इज ओके टू हैव इट, लेट्स टॉक अबाउट इट. Anything else that all 3 of you would like to say besides what we have covered? Please go ahead. In one
I
line.
think one thing I'd like to add is not just awareness, it's also about visibility. So we have to do as much as we can to make a support system like this accessible to people. So when they type into like Google, like I did, and didn't find anything, I don't want them to face the same thing. Immediately these things should pop up, whether it's you talking, me talking, us talking, support groups. I want to be able to see more. So I think creating a, something that's easy to access, I think that's
Virtual
very important.
presence, we really need to make virtual presence, and that's one of the reasons you three girls are on board with us. And besides this, while we are talking, we have a Happiness After Cancer WhatsApp group in case किसी को reach out करना है. इन 3 girls के Gmail addresses होंगे description box में. Besides this, you can reach out to us by sending a mail happinessaftercancer@gmail.com. WhatsApp group है जहाँ कोई जजमेंट नहीं हो रही. nobody is judging you. as अनन्या का पुराना वीडियो है, पूर्वा का वीडियो है और सुष्मिता की इंटरव्यू बहुत सुन आने वाली है. they are all talking about the same thing. ask your questions. चुप नहीं बैठो. अंदर कमरे में रोना ठीक है, but remember, help is just at the click of your mouse or your swiping, as you young children say. Anything else, girls?
I just want to add one thing. जैसे आप हम तीनों अभी खड़े हैं या फिर आए हैं यहाँ पे, I just want to address to the other cancer patients also या फिर survivors कि आप भी आगे आओ. हर एक की जर्नी अलग रहती है. किसी को आपके जर्नी में से क्या मिलेगा पता नहीं, बट आप कोई भी एज से हो, आप जुड़ो. ऐसे नहीं है कि बातें करनी नहीं है. जितना शेयर करोगे उतना ज्यादा अवेयरनेस होगा, उतना ज्यादा किसी का भला हो जाएगा और आप एक की भी लाइफ में कुछ डिफरेंस कर पाओगे. तो देन यू हैव रियली लाइक आपकी कैंसर जर्नी आपने सही तरीके से कंप्लीट करी है, ऐसे मैं बोलूंगी. सो जस्ट कम अप, ऐसे मत बैठो. जितना भी आपकी जो नॉलेज है वो शेयर करो दूसरों के साथ.
And I think also, thank you, Nidhi Aunty. Without this platform, I wouldn't have met Sushmitaa and Poorva. So thank you. It's always so nice to meet them. You just form this instant connection. There's so much understanding, and I love it.
And I think
you
the
so much.
journey completes when you kind of share that wisdom to other people, like when elder people say, the experience comes and all. And secondly, I think we just need to get little more considerate about people who are suffering from something like that, little empathy. And that I think we need to take this mental health thing very seriously, because if that is supported, I think the journey will go. It's just the battle here that needs the support the maximum. Your body follows what your mind says, so I think mind is
That's
something that needs the support.
Yes.
Exactly. We said it's like that. Okay, someone is there that like she has gone through the same thing, and मेरे साथ वो है, so I can share and I can ask. कुछ भी छोटी छोटी बातें मैं पूछ सकती हूँ, and it's the same thing, same experience we are sharing. तो वो एक अलग ही बोलते हैं ना, दवाई का काम करते हैं in treatment. So it's important.
Thank you once again, girls. आपका सबका अपनी opinion, story share करने. I'm sure somewhere, anywhere in the universe, कोई सुनेगा तुम तीनों को और बहुत सारी दुआएं और ब्लेसिंग्स देगा कि 3 बच्चे बाहर आके पब्लिक प्लेटफॉर्म पे शेयर करना आसान नहीं होता. योर स्टोरी, इट रिक्वायर्स लॉट्स एंड लॉट्स ऑफ गट्स एंड करेज. एंड सून, ये आई रिपीट माई सेल्फ, दोनों गर्ल्स अनन्या और पूर्वा की स्टोरी अवेलेबल है हैप्पीनेस आफ्टर कैंसर में सुनने के लिए. सुष्मिता की सून वी आर गोइंग टू पुट अप हर स्टोरी. So God bless you, girls. Wish you all the best in life and health, and looking forward to more conversations with you three.